Hello YouTube, I'm Dr. Fox. Today, I'm talking about birth control or contraception. Both you and partner, if you have one, should consider several things before you choose whether to use birth control and what type, including how safe and effective each method is, whether you have access to it and can afford it, and whether you feel comfortable using it in terms of your faith and culture. You have to make your own choice, not be pressurized by anyone else, and you should only make your decision when you have all the information. It is often useful to consult a contraceptive advisor or doctor at clinic. Different women and couples are happy with different solutions, so it depends on you and your circumstances, and you might start on one type of contraception and change to another in the future. You should also consider that not all forms of contraception protect you against both pregnancy and HIV and other sexually transmitted infections or STIs, such as chlamydia. No hormonal method does this, so if this is important to you, you should use a condom. Okay, what questions will your contraception advisor ask you? To help you choose the best method, they will probably ask you when, if ever, you intend to get pregnant, how often you have sex, and whether you have sex with more than one partner. They will also want to get a picture of your overall health and background, and then she can tell you about the effectiveness of each of the methods you're interested in. They might also remind you to think about details like whether you are the sort of person who will remember to keep consistent daily records, take a pill at the same time every single day, or be happy asking your partner to use a condom. Okay, what types of contraception are there? There are basically 5 forms of birth control, each of which has their own advantages and disadvantages. The first type is the barrier, which prevents the egg from meeting the sperm so it can be fertilized. Barrier methods are condom, diaphragms, cervical caps, sponges, and spermicides. Probably the best known of these is the condom. You can get either a female or male condom, although male condoms are much easier to find in pharmacies. The man puts it on over his penis to stop the sperm coming out into the woman's vagina. Most condoms are made from latex or other synthetic materials, and these also give protection against HIV and other STIs. The average success rate, the woman does not get pregnant, is 87%. The female condom is a sort of lining made of rubber that the woman inserts inside her vagina to stop the sperm meeting the egg. The female condom gives you some protection against STIs and has a 79% success rate. One disadvantage to both male and female condoms is that they can only be used once, and if they are made from latex, they can be damaged by oil-based products like massage oils and body lotions. Although most types of condoms are already lubricated, a lot of couples find it more comfortable to use extra lubrication. The diaphragm and cervical caps are little cap-like devices that you push up inside the vagina to block the sperm. You have to put these in before you start having sex, and you also have to use a spermicide, which is a sort of lotion which kills sperm. You need to go to your doctor to get one in some countries because they are made in different sizes and they will have to check which size you best. Both these methods have an 83% success rate. Another barrier method is the sponge, which is soaked in spermicide and pushed into the vagina to cover the cervix. Each sponge is effective for 28 hours and you have to leave it inside you for at least 6 hours after you have sex. Then pull it out and throw it away. The sponge works best for women who have never had a baby, with average 86% success rate, than for women who have given birth with 73% success rate. You can also use a spermicide on its own. It comes in several forms such as foam, gel, cream, suppository or tablet, but it's not easily available at pharmacies in Japan. You put it inside your vagina no more than 1 hour before you have sex and leave it for about 8 hours afterwards. Typically, using a spermicide on its own has a 79% success rate. The second type of contraception is hormonal, which makes changes to the hormones in your body to regulate ovulation and the type of cervical mucus you produce. You can get hormonal contraceptives in the form of implants, injections or shots, pills, a patch, and a vaginal ring. These need to be prescribed by the doctor, and you can't get some of them in Japan. The implant is a thin rod which a doctor inserts under the skin of your arms. It releases progestin into your body over 3 years, after which you need to have it replaced. Typically, it is extremely effective with a success rate of 99.9%. The injection is also given by a doctor. Progestin is injected into either your arm or your buttocks, and you need to get it redone every 3 months. This has a slightly lower success rate at 96%. You can take an oral contraceptive, usually called the pill, which contains both estrogen and progestin. The pill is prescription only, so you have to go to a clinic, and it is not suitable for all women. Firstly, you must remember to take it at the same time each day, or it loses effectiveness. Secondly, if you are over 35 and a smoker, or if you have a history of blood clots or breast cancer, you should choose another option. Typically, the combined pill has a success rate of 93%. If you can't take estrogen for medical reasons, you can take the mini pill, which only contains progestin. Again, this is prescription only, and you must remember to take it at the same time each day. It may be a good option for women who can't take estrogen. Typically, it has the same success rate as the combined pill at 93%. Alternatively, you can wear a skin patch on the lower abdomen, buttocks, or upper body, which releases progestin and estrogen into your bloodstream. You have to be careful to stick to the right routine if you are using a patch, putting on the new one once a week for 3 weeks, then going without one during the 4th week so you have a period. This method has the same typical success rate, 93%. The ring is placed inside your vagina. Like the other method, it releases progestin and estrogen, and you have to stick to a routine. Wear one for 3 weeks, take it out for a week, you have a period, then put it in a new one. It has the same typical success rate of 93%. The third category of birth control is intrauterine devices or IUDs, which are small objects inserted by a doctor into the uterus. They are both hormonal and barrier methods because they both cause changes in the cervix and stop sperm traveling up into the fallopian tubes. There are 2 types, copper and levonorgestrel. Both are T-shaped. The copper one can stay inside you for up to 10 years, while the LNG can only stay for a maximum of 5 years. The typical success rates are similar, 99.2% for the copper one and between 99.6 and 99.9 for the LNG IUDs. For people who are sure they do not want any or any more children, there is the option of sterilization, which is an operation carried out in hospital to make a person permanently infertile. For women, the operation usually consists of tubal ligation, which means the fallopian tubes are tied so the sperm cannot travel up them to meet the egg. This procedure only fails in 0.5% of women. The operation to sterilize a man is called a vasectomy. Similarly, it is done in hospital, but the man doesn't need to stay overnight. Afterwards, there is no sperm in the man's ejaculate, so he cannot make a woman pregnant. Most men recover in under a week and then go back to the doctor about 3 months later or so for a test to make sure their sperm count has dropped to 0. Contraception should still be used before then. About 0.15% men have a failed vasectomy. Finally, there are naturism or fertility awareness-based methods where you monitor your menstrual cycle so you know when you are more or less fertile. Most women use an ovulation home test kit or fertility monitor device available in pharmacies to help them. Fertility awareness is based on your learning when your body is most fertile by monitoring certain signs such as temperature and cervical mucus. Women who have a regular menstrual cycle are fertile for 9 or more days each month. So if you want to get pregnant, you should be having sex during these days. And if you do not, you should not have sex at all or use a barrier method. Failure rates are anywhere between 2% and 23%, depending on which method you choose and how rigorously you stick to it. Okay, last question. Which types of birth control protect you against STIs? The only types of birth control that can protect you from STIs are male and female condoms. However, as they do not have the highest success rate at preventing pregnancy, if you want protection against both STIs and pregnancy, you should use dual protection, which means using both a condom and some other form of birth control, such as the pill or an IUD. Okay, thank you for watching. See you soon.